Hi, I'm Karen Felsted, and I want to talk about how to increase veterinary visits in this economy using results from the Bayer Veterinary Care Usage Study, Part 2. Let's talk a little bit first about the trends that we've been seeing in veterinary medicine that led to the Bayer Veterinary Care Usage Study. First of all, even though technically the recession has been over for some time, to most of us it doesn't feel like the recession is over. This information comes from the NCVEI, and we looked at practice revenue for the first 5 months of 2011 compared to the first 5 months of 2010. As you can see here, about 30% of practices were seeing an increase of greater than 5%. And certainly that's good, but when we remember the 6 to 8% average increases that we were seeing before the recession, this isn't quite as good if we're looking at practices as a whole. About 22% of practices saw an increase of 1 to 5%, about 16% were flat, and unfortunately, about 32 or 33% of practices are still seeing declines, some greater than 5%. So even though the recession is technically over, it's a challenging time, and it's expected to be a challenging time for some years hence. If you look at this information from the Bayer Veterinary Care Usage Study, you'll see that patient visits have been in a serious decline over the last couple of years. 51% of practices saw a net decrease in their patient visits. About 14% had visits that were flat, and only about a third of practices were seeing an increase in patient visits. So very clearly, this helps us put numbers around what we know we've all been seeing in our practices, or most of us have been seeing in our practices, and that's that there's less people coming through the door. Obviously, revenue follows visits, and so we see that 42% of practices from 2009 to 2010 saw a decline in their revenue, about 11% were flat, and about 47% saw an increase. There was actually a greater revenue increase than there was a visit increase, and so what that's telling us is that we're seeing something else impacting revenue increases rather than just the number of people that walk through the door, and that's either going to be fee increases or it's going to be we're doing a better job of communicating the need for care to clients, and so the people who do come visit us are spending more money and providing more care for their pets. We have many open appointments. This slide is from the Bayer study as well, and it shows for the first quarter of this year, of 2011, about a third of appointments in practices went unfilled. So we have a lot of capacity, we have a lot of ability to see patients that we're not utilizing simply because the demand isn't there at this point. What's important to remember when we're looking at these trends is that the recession isn't our only issue. Because the recession has dragged on for so long and it's clearly been a hit on veterinary medicine, we tend to think that once the recession is over, life is going to be better. And certainly life should be a little bit better as the economy improves, but there's clear evidence that veterinary medicine was seeing some declines well before the recession started. So if we go back and we start looking in the early 2000s and we look at pet numbers, they were increasing over that time period. Not a lot, but definitely increasing. But during that same time period, we were seeing a decline in transactions per veterinarian, new clients per veterinarian, active clients per veterinarian, total veterinary visits per pet, the percentage of households with pets who visited a veterinarian, and patient visits per week. So no matter how you look at it, no matter which statistic you measure, we're clearly seeing a decline in the number of people who are visiting veterinary practices. What I think is interesting about this information is that some of these studies look at veterinary metrics, so at activity going on in the veterinary practice, and others of these studies actually measure pet owner behavior. But no matter which one you look at it, you're seeing the same downward trend. And not only is this a business issue, but we have a clear quality of care issue. Just because somebody owns a pet doesn't mean that they're clients. If you look at information from the AVMA study of pet owners, which they do every 5 years, so this is 2006 information, which remember is pre-recession, we can see that a large number of pets aren't getting basic care. 24% of pet-owning households spend zero at a veterinarian's during any given year, in this case in 2006. About 27% of pet-owning households spent less than $200 a year at a veterinary practice. What's important to remember about that number is that's pet-owning households. So that's a household that could have more than one pet. You all work in veterinary practices, you know as well as I do, it's very hard to provide basic care for $200 a year. And if we're looking at $200 a year for 2 pets or 3 pets, then that's $70 a pet or $100 a pet. It's not a lot of money. About 22% of pet-owning households spent over $500 a year on their pets. And again, $500 a year can cover a fair amount of basic care, but if you've got a really sick pet or a pet that's been injured in an accident, that's not going to go very far, and only 22% of households were spending that kind of money. During this same time period, when we see pet owners not spending a lot of money, we've also seen an increase in the incidence of disease. This information comes from the recently released Banfield Pet Hospital State of Pet Health 2011 report. They have a huge sample size represented in this study, about 500,000 cats and almost 2 million dogs. So you look at this information and it's very, very telling. What this shows us is a 16% increase in canine flea infestation cases and a 12% increase in feline flea infestation cases, a 6% increase in canine tick infestations. This is over a 5-year period. The diagnosis of Lyme disease has doubled in the last 5 years, and we're seeing very large increases in diabetes mellitus as well. So it's clear, at least in my mind, that there is a link between the amount of veterinary care that pet owners are providing and some of this increased incidence and disease that we're seeing in our pets. We'll go ahead and stop now. We'll pick up in Chapter 2 and look at some of the key findings from the Bayer Veterinary Care Usage Study.